These are what causes diabetes. Diabetes is a chronic disease that occurs because the body is unable to use blood sugar, which is the glucose, properly. The exact cause of this malfunction is unknown, but genetics and environmental factors play a part in them. Now I will discuss with you some specific causes of diabetes. 1. Insulin. This is the cause of type 1 diabetes. It occurs when insulin producing cells are damaged or destroyed and stop producing insulin. The resulting insulin deficiency leads to much sugar in the blood and not enough in the cells for energy. Secondly, insulin resistance. This is specific to type 2 diabetes. It occurs when insulin is produced normally in the pancreas, but the body is still unable to move glucose into the cells for fuel. The pancreas will create more insulin to overcome the body resistance. Eventually, the cells wear out. At that point, the body slows insulin production, leaving too much glucose in the blood. 3. Genetics and family history. Genetics also causes diabetes. If you have a parent or sibling with diabetes, your odds of developing them yourself increases. Genetic conditions like cystic fibrosis, hemochromatosis can both damage the pancreas, leading to a higher likelihood of developing diabetes. 4. Gestational diabetes. Women who develop gestational diabetes during pregnancy are at higher risk for developing type 2 diabetes later in life. Women that develop a baby that weighs more than 9 pounds are also at greater risk. A small percentage of pregnant women may develop gestational diabetes. It is thought that hormones developed in the placenta interfere with the body's insulin response. This leads to insulin resistance and high levels of glucose in the body. 5. Age. According to the Mayo Clinic, your risk of developing type 2 diabetes in particular, however, the incidence of type 2 diabetes is increasing dramatically among children, adolescents, and younger adults. 6. Obesity. Excess body fat can cause insulin resistance. Fatty tissue may cause inflammation that can lead to insulin resistance. But also remember that many overweight people never develop diabetes. 7. Poor diet. Poor nutrition may contribute to type 2 diabetes. A diet high in calories, fat, and cholesterol increase your body's resistance to insulin. 8. Lack of exercise. Exercise makes muscle tissue respond better to insulin. Then if you are lacking in regular exercise and resistance training, then you are at risk of having diabetes. 9. Hormonal conditions. Although hormonal conditions can lead to a diabetes, but they are also rare. These are the following conditions that can sometimes cause insulin resistance. 1. Cushing syndrome. It raises blood glucose level and may cause diabetes. 2. Acromegaly. It results when the body makes too much growth hormone. This can lead to excess weight gain and diabetes if left untreated. Hyperthyroidism. These symptoms occur when the thyroid gland produces too much thyroid hormone. Diabetes is one of the possible complications of this condition. If you want to know more about diabetes and how it works, you can get it in any of my videos in my channel. So remember to subscribe and hit notification bell. Thank you.